Four Seasons Hotel Project, Madinati. Occupational Safety, Health and Environment Department welcomes you. Content of the presentation. Number 1, COVID-19 diagnosis, classification and recommended treatment chart. Number 2, occupational safety, health and environment instructions applied in the project.
Hi, I'm Amy, and I'm going to accompany you for the duration of the presentation. The content of the presentation will be discussed in 2 parts. In the first part we will talk about COVID-19 diagnosis, classification and recommended treatment chart. In the second part, we will talk about occupational safety, health and environment instructions applied in the project. First, the infection is diagnosed if there are 1 or more of the following symptoms: fever, breathlessness, headache, diarrhea, cough, runny nose, body aches, sore throat, losing sense of taste or smell. Also, in case of a direct contact with confirmed case. Upon initial diagnosis, it is started in self-quarantine at home until we have a medical confirmation. Then a PCR analysis is performed. If the PCR result is negative, may be false negative in case of direct contact or symptoms appearance. To be sure, a CT scan is done. If the result of the CT scan free of GGO, the suspected case is free of COVID-19 infection, can return to work in time. But if the CT scan has a GGO, this is a strong indication of the presence of the COVID-19 ground glass opacity. If the PCR result is positive, confirmed case. If the PCR is not available, some tests, medical investigations, labs, CBC, CRP, serum ferritin, D-dimer, radiology, CT. The results of the analyses are based on the following criteria: CBC, absolute lymphopenia less than 1000 is risky, CRP, above 6 is risky, ALT, above 50 is risky, serum ferritin, above 300 for men, 150 for women is risky. D-dimer, above 0.5 is risky, CT, if there are a GGO is risky, ground glass opacity, depending on the result of the tests, negative or positive, the case. 3 categories according to the severity of the symptoms. First case mild. The second case moderate. Third case severe. First case mild, good general health condition with minor symptoms that mentioned above, can be treated at home. Good nutrition, regular sleeping pattern. Hot drinks, vitamin C complex 1 mg every 24 hours, zinc 50 mg every 24 hours. Back to work. After the disappearance of all symptoms, ensure that at least the last 7 days without fever. No more investigations are required, just the site doctor confirmation. The second case moderate, like the mild case with high fever and deeper coughing, can be treated at home under medical supervision. Good nutrition, regular sleeping pattern. Hot drinks, vitamin C complex 1 mg every 24 hours, zinc 50 mg every 24 hours, Zithromax 500 mg every 24 hours. Back to work. After the disappearance of all symptoms, ensure that at least the last 7 days without fever. Normal lab results, normal CT. Third case severe, all the common symptoms mentioned above with extreme appearance coexisting with any chronic disease must be treated and isolated at hospital. Back to work, depending on the hospital's decision. Normal lab results, normal CT. The second part of the presentation: occupational safety, health, and environment instructions applied in the project. All precautionary measures are implemented according to the safety plan. Measuring the temperature of anyone entering the gates of the project, with an emphasis on wearing masks. Gate number 1 for employees and car entry, the rest of manpower for the project from gate 2. All facilities and cars in the project are sterilized through a third party once a week. In addition to the daily sterilization in the project, sterilization in the offices of TMG, sterilization in the offices of Hill, sterilization in the offices of CCC Atrium JV, sterilization inside the project's transportation, awareness training about the emerging coronavirus through the medical administration and safety team, with careful consideration of applying precautionary measures in gathering places such as training halls, Thank you for listening. The Department of Occupational Safety, Health, and Environment wishes everyone full health and wellness, and that everyone returns to their homes safely.